ecstasy, or MDMA. 3. 4. Methylenedioxymethamphetamine is a synthetic drug often used in party settings for its effects on energy, empathy, and mood. It typically comes in the form of colorful pills with various logos or symbols and is often mixed with other unknown substances. While initially euphoric, ecstasy also dramatically increases body temperature, heart rate, and blood pressure. Other side effects include dehydration, hallucinations, extreme anxiety, and depression after the effects wear off. Long-term use can damage brain cells that regulate mood and memory, and can lead to dependence. Heroin is a synthetic derivative of morphine and is one of the most addictive narcotics in the world. It comes in the form of a white or brown powder and is typically used by injection, snorting, or smoking. Heroin acts rapidly on the brain and produces intense euphoria. However, these short-term effects are offset by significant health risks. Heroin causes respiratory problems, infections of blood vessels and organs, and brain damage. Because its use often involves sharing needles, the risk of contracting HIV/AIDS and hepatitis also increases. Heroin addiction is very difficult to treat and often requires long-term rehabilitation. Morphine is a narcotic derived from the sap of the opium poppy plant, Papaver somniferum. This substance is used medically as an analgesic or acute pain reliever, particularly for cancer patients or post-surgery patients. However, use without medical supervision is extremely dangerous. Morphine works by depressing the central nervous system, causing drowsiness, euphoria, and pain relief. However, excessive or unsupervised use can cause loss of consciousness, respiratory depression, and even death. Morphine is also highly addictive and can cause severe physical and mental dependence. Cocaine is derived from the leaves of the Erythroxylum coca plant, which grows in South America. This compound acts as a central nervous system stimulant and is highly addictive. Cocaine is usually a white powder and is consumed by snorting, injecting, or burning it to smoke it. The effects of cocaine are rapid and intense, with feelings of increased confidence, increased energy, and euphoria. However, these effects are often followed by symptoms of extreme fatigue, depression, and anxiety. Long-term use can lead to heart problems, strokes, seizures, brain damage, and severe physical and psychological dependence. Marijuana comes from the cannabis sativa plant. This plant contains an active compound called THC, tetrahydrocannabinol, which affects brain function, particularly the areas that regulate memory, concentration, and coordination. Marijuana is typically consumed by smoking it or by mixing it with food and drinks. Marijuana use can produce temporary euphoria and feelings of relaxation, but it can also lead to perceptual disturbances, anxiety, paranoia, and decreased motor skills. Long-term, marijuana can impair brain function, trigger dependence, and increase the risk of developing mental disorders such as schizophrenia, especially if used from a young age. Methamphetamine is a highly addictive synthetic stimulant. It usually comes in the form of clear crystals like broken glass or a white powder. It is used by snorting, injecting, or burning it for smoking. Methamphetamine works by increasing dopamine levels in the brain, producing euphoria, a sense of focus, and high energy. However, the effects are devastating. Severe insomnia, drastic weight loss, aggressiveness, and brain damage can occur. Long-term use can cause permanent neurological damage, mental disorders, and damage to organs such as the heart and kidneys. LSD is a powerful psychedelic derived from lysergic acid. It is usually obtained from certain mushrooms or made synthetically. LSD is typically consumed by placing a small strip of paper soaked in LSD solution on the tongue. The effect is described as a trip, which can last up to 12 hours. LSD users experience distorted perception, visual hallucinations, time shifts, and illogical thinking. While LSD doesn't cause physical dependence, its use remains high risk because it can trigger psychosis, severe anxiety, and, in some cases, a condition called flashback, a sudden recurrence of hallucinatory experiences even long after LSD has stopped. Fentanyl is a powerful synthetic analgesic pain reliever commonly used in medicine to treat chronic or post-surgical pain, particularly in cancer patients. It works by mimicking the body's endorphins and binding to opioid receptors in the brain, producing euphoria and very short-term pain relief. Fentanyl is 50 to 100 times more potent than morphine and only requires microdoses to have an effect. Due to its high potency, fentanyl abuse is extremely dangerous. Use beyond medical doses can cause respiratory depression, loss of consciousness, and even death from overdose. Many fentanyl-related deaths occur when the substance is mixed with other illicit drugs, such as heroin or cocaine, without the user's knowledge.